So Vijay, what are the common symptoms that a patient would come to you with if he has a shoulder problem? Is it pain in the shoulder or there could be something else also?
The common symptoms with which patient present in the shoulder problem is mainly pain and followed by stiffness and very rarely giving away of the shoulder.
How often have you seen patients who come to you with not so much pain but with movement of the shoulder considerably reduced? What would you tell them?
So basically the reduction of movements in the shoulder is called as stiffness, ensuing stiffness by the patient. So the commonest cause is adhesive capsulitis or frozen shoulder, which presents mainly in the elderly population. Stiffness as a symptom is very uncommon in the younger active subgroup. So depending upon the presentation, how severe it is and how long it is, we treat the patients accordingly. Whether the patient presents with stiffness for the past 1 month or 6 months or a year or so, depending upon their chronicity, we treat the patients accordingly.
Many times the patients come with pain in the shoulder or just adjacent to the shoulder, somewhere between the neck and the shoulder. How easy it is to differentiate whether it's a neck problem or a shoulder problem?
Shoulder pain and neck pain are closely related. Neck pain, patient presenting with it will complain of pain that radiates down to the elbow to the fingers, whereas shoulder pain restricts itself to the arm up to the elbow. It will never radiate below the elbow. So that is one main difference between the neck pain and shoulder pain, which a patient can by himself or herself deduce and then seek help accordingly.
Do you think the frequency of shoulder problems being diagnosed has increased? Is it because of any particular reason, or it's just that the understanding of shoulder problems has increased?
I think in the last decade or so, people have got involved more into outdoor activities. So we get to see a lot of sports related injuries. So this, I think, is the main cause for patients coming with a lot of shoulder pain. And the awareness, obviously awareness is also a main factor compared to decades ago. Now patients are more aware about what their symptoms are. They get the help of internet and then come to us to seek answers for the problem. It's awareness with outdoor activities. Both has led to increase in footfall with shoulder problems.
Does diabetes, which is a common accompaniment of the middle-aged population, have a particular affinity for having shoulder problems?
Diabetes is definitely a main risk factor for pain and stiffness presenting in middle and old age population. In fact, if you look into the prevalence of pain and stiffness in this subgroup of population, almost all of the diabetics would have encountered shoulder pain and stiffness of some degree or mild to severe in their lifetime. So the commonest cause or the risk factor associated with stiffness is diabetes. 25% of patients presenting with stiffness can be diabetic if retrospectively questioned for.
You must have heard of many patients coming and telling you that my shoulder gives way, especially when I am doing overhead activity. He may be young or a middle-aged patient. What do you think he is talking about, he or she?
So giving away of the shoulder is a very specific symptom. It is not a vague symptom. So definitely that particular symptom must be elaborated upon. Usually it follows a sports injury or any kind of slip and fall with an outstretched hand. Without it, giving away of the shoulder doesn't happen. Although uncommonly patients with ligamentous laxity, even while doing activities of daily living like overhead activity, can experience the symptom. But it is very important to get an accurate history from the patient with regard to this symptom. So giving away of the shoulder generally depicts that the shoulder is unstable. So a classic history elicitation followed by an examination and then recommending proper investigations will help us in treating the patients better.
Is this something similar to when the patient tells you, I dislocated my shoulder? Is it the same thing or they are different?
I think giving away of the shoulder is a symptom of shoulder dislocation until proved otherwise. Sometimes patients may miscommunicate with us, but almost always we are in the same boat when it comes to giving up the shoulder. The patients are pretty much accurate with the symptom, and it leads us to the diagnosis straight away.
At what age or stage would you tell the patient to really exercise the shoulder regularly rather than the legs, or as much as legs?
Generally speaking, shoulder exercises in the form of cuff strengthening and deltoid strengthening exercises can be advocated as a second stage of treatment. First, we address the pain, because any painful shoulder will cause wasting of these muscles around the shoulder. So we need to diagnose the condition and then treat it with appropriate anti-inflammatory painkillers and physiotherapy. And once the pain subsides, you break the vicious cycle, and then the stage of exercises comes into play. So exercise is an important way of managing these conditions in order to prevent further episodes of pain.
Is it always necessary for you to do, besides an X-ray and MRI, before you start treatment for shoulder in the form of exercises? Or MRI is really going to come into play at a later stage?
I think although MRI is an important diagnostic tool in shoulder practice, we don't usually take MRIs for all patients. It is very important to examine the patient thoroughly after listening to the history and then treat the patient based on the history and clinical examination, if needed a basic X-ray. There is no need to rush for an MRI for all these patients. I do MRI in the first visit for a patient if he or she is an athlete in whom the questions are really pertinent to return to play. For that it helps. Otherwise, for a common population, I treat it in the traditional way of symptomatic management, basic X-ray, physiotherapy, wait for a week or so, see how it responds to the treatment, and then step it forward.
Like you are aware, my last question, like you are aware that knee problems are so very common, and keyhole surgery has become a norm for return of the patient or particularly sports person back to his field. Is there anything like that available for the shoulder also?
I think shoulder keyhole surgery has grown leaps and bounds in the last decade. It is because of the patient-driven outcomes. The outcomes following the treatment of injuries around the shoulder with the keyhole surgery has benefited patients a lot, and it's becoming increasingly popular, so much so that in our practice we see almost 50% of the keyhole surgeries being done for the shoulder arthroscopically. So yes, that is the way for future.
Thank you.
Thank you very much.